Dr. Ajani ko.
Yeah, ready for the session.
Yeah. So you can start now.
Okay.
And your speaker is also waiting for you.
Yeah. Your speaker already joined. Thank you, Sahari sir. Thank you, Hindi team. Now we are moving to the English session. Today is our 1848th day of continuous webinar. Thank you, everyone, for participating in this webinar. Now we are going to celebrate our 5th year on 28th. Only few days more to join together. Thank you so much, everyone. And today's our speaker is Dr. Samar Chatterjee. Before beginning the session, we will have a silent prayer. Thank you, everyone. Today's our guest is Dr. Samar Chatterjee. He already taken the classes. Today is the second part of the last class. And you already know about him. And even though I'm just introducing, he's HOD in Materia Medica in the Department of Materia Medica in JIMS, Homeopathic Medical College, Hyderabad. And he worked as an examiner, UG, PG paper setter, moderator in different universities. Member of drug proving committee, and published many articles in journals, reviewer of book, and 39 years of experience and 34 years of teaching experience. We are so happy to invite Dr. Samar Chatterjee. You're welcome. And today's topic is Suppression to Expression, second part. Sir, you can start now, please. Please, okay.
Namaskar. I am audible and visible, ma'am.
Yes, you're audible and you're visible.
Good evening, friends. Respected homeopaths, Namaskar. I would like to extend my gratitude to respected dignitaries, Dr. Dhanesh, Dr. M.K. Sahani, coordinator of today's scientific session, respected ma'am, respected senior teachers, respected director, JIMS Homeopathic Medical College and Hospital, Dr. Nobin Pavaskar, and Principal Dr. Dhole sir, all the JIMS Homeopathic Medical College and Hospital members, faculty members, and thanks to Mathematics Department, all the teachers, Dr. Benu Sharma, Dr. Tipti Lokhi, and others, and my dear undergraduate and postgraduate students, and respected senior audience, senior practitioner. Today's webinar, Suppression to Expression, a Homeopathy Journey Staphysagria. Today is the second part of the subject. Now, previously I have discussed everything in details of the. Now I am precisely expressing the mental essence of the phase of emotion, phase 1 of the Staphysagria. Staphysagria having the different personality, characteristics, personality we can identify easily, and we can apply our mathematical knowledge in the field of practice nicely, and we are getting result. Already I have explained 2 cases yesterday, and today I am going to present 7 more cases if time is permissible. And now I would like to express that Staphysagria about the child. You know that child is soft, shy, gentle, and dignified. Since her childhood, he developed in this way. Whenever they have any emotion, they keep it inside, doesn't express directly, suppress it, and still they are kind, gentle, soft-spoken, and with bitterness inside, but not so much bitterness inside. Bitterness inside is more prominent in naturally. The bitterness develops along with suppression of emotion due to the dignifiedness, and it is Staphysagria is a remedy for multiple grief like natamute, causticum, carcinosin, like that. Now, phase 2. Below the dignity, there is lot of suppression. They cannot express. Even after patients having so many incident of insulting, ignoring. Allen says, Dr. Allen in his keynote says, after being insulted, too dignified to fight, subdued wrath starts developing physical symptoms. So he cannot express his sufferings, grief, sorrow. He kept inside the mind. He subdued the wrath, starts developing physical symptoms. But Naxumica, nitric acid, in case of any insult, express his anger violently. What is the affected by the injustice? Staphysagria. Causticum also affected by injustice, but he knows how to protest it. He knows to explain his emotion, his problem. But Staphysagria doesn't fight because it is beyond the patient's, our patient's respect, Staphysagria respect, beyond dignity. Sometimes due to lack of courage, can't express and closes it. He is not able to express that one about his problem. He don't like to share. Can be compared with causticum. Causticum reverts back and fight. He tell the others about he complaining for the justice. Next, the phase 3. The expression of the phase 3, it is another phase of expression, suppression, followed by expression. After suppression, for so long, the expression phases comes out. What happened in phase 3? Long time, repeatedly, months and years together, having grief, injustice, and insult, then it is coming. Then what it will express? How it express? First starts the trembling in anger. Patient cannot shout loudly, but his extremities trembling in anger. Voice lost, speechless. Face become red. Weakness after anger. Even after anger, hemiplegia, brain stroke can be take place. And after the sufferings, operation, torturing, sometimes the patient anger throw things, the article, the water bottle, or push the table matters, then strike desire. Example of the phase of expression: daughter of a lady and sons of a gentle lady coming back home late at night. That family belongs to a good family, educated family. But the lady, the mother, is observing that her children is coming late, and son is addicted to alcohol. He used to go to bar, but can't express her anger. She doesn't like. She is waiting until her son is coming back to home. But he suppresses anger. She cannot express that you are doing wrong. You should not do it. It is beyond the ethics of the family. He suppressed her anger, grief, sorrow. And like it still, she cannot express her anger. After continuous incident of the same thing, once she expressed her anger by throwing things like water bottle, utensil, and pushing away the table. Next, I am going to discuss about the phase 4. That is adult. Adult is having good wife or wife having good husband with good children. Is not that person, the male, is not satisfied with their spouse, develops sexual contact with the others, illegal sexual contact, excess sexual desire, and leads to having illegal contact, multiple partners along with guilt. After the contact, the patient feels guilt, a feeling of having done sin. And in Boric says, Dr. Boric written that excess and sins. Praise God. After the incident, that particular person prays to God. Please excuse me, God. It is feeling of guilt. The patient is guilty. Can be compared to the thuja and fluoric acid. Here it is happening. The thuja is also having multiple contact with the females, fluoric acid also. But fact is that thuja is not feeling guilty. Thuja patients is thinking that he is enjoying his life. It's a sexual pleasure. So he don't have any type of shameless, and shy. He's not feeling guilty. They have multiple partners enjoy sexual pleasure, but there is wrong suffered or guilt due to sexual contact. There is no guilty feeling. Next, that is another phase of 5. That is contrary of hypersexuality. There are 2 types of expression. One type of Staphysagria person having initially shy, mindless, and lack of courage to seek partner. Even after marriage, she cannot express his sexual desire to her wife. Thinks that her wife, whatever she thinks about him. This is one kind of expressions, suppression and followed by suppression. And this type of inability about sex and sharing here his desire leads to depression, leads to headache, leads to cardiac trouble, leads to irritable bowels, leads to irritation in the throat, frequent urging for urination. On the other side, if the Staphysagria patient, young adult, after married, if he don't express, don't share his emotion, then he goes to another way. Excessive masturbation, addicted to porn, and then develops guilt and sins. So it is another way. So one side, the person become depressed due to inability to sex, though the sexual desire is there. And on the other side, the person having sexual desire, he don't tell his emotion, his desire, then he doing masturbation, addicted to porn, and sometimes and as a result, it develops, the patient feels guilty. Then another phase of hypersexuality in Staphysagria, according to Dr. Pathak, he explained nicely that in case of unsatisfied sexual urge in widows, in early age widows, and then what happened, though conium maculorum also is a very good drug for the widow, unmarried, bachelors ladies. Staphysagria, we can apply if we see that widows having the unsatisfied sexual urge and producing problem, so many problems, imagines insult, irritability coming, cannot concentrate her mind towards her own day-to-day work, nervous, excitable, and violent sometimes in behavior, but not so violent like belladonna. Try to suppress her anger and emotion. Believes the person, he will lose his fortune. A person who having some abnormal sensation due to suppression of sex, suppression of his emotion, then abnormal sensation, the numbness in between the eyebrows, will lose his fortune as if he lose his wife will leave him. Abnormal sensation, illusion is there, as if a wooden ball is on the forehead in the glabella area, and he try to remove it. He is nodding his head, but it is not removing. Actually, it is a sensation. It is the expression, the result of suppressed sexual desire and pleasure. Sensitive about what others will think about him. Then suppression and expression, I am telling you in short, suppressed anger, dignity or honor wounded, leads to trembling in anger, voice lost during anger, speechless, face becomes red, and cerebral stroke or hemiplegia after anger, and maybe develop prostatitis in case of male, styes and tumor sometimes as a result in the long run in case of female. Uterine fibroid or ovarian cyst may develop. According to George Vitolkas, elements from grief, the romantic griefs and disappointment leads to diarrhea, frequent urination, hardened tumors, and the enlarged prostate. The suppression, that is onanism, abuse of sex, suppression, sexual excess, or by persistently dwelling on sexual subjects, thinking about the sexual pleasure, that leads to express. As a result, what happened? The patient become indifferent, low-spirited, dullness of mind. Patient is listless, sad, gloomy, and there is a development of the chagrin and vexation, mortification, dreaming of the future, sad, distressing thoughts about one's illness, aversion to mental or physical labor, inability to think, loss of memory, forgetfulness, hypochondriasis, thinks about her disease, his disease, as if he has been suffering from so many diseases. Taciturnity, face, and as a result, face becomes sunken, averse look, as if he has done so many wrong things. He's a sinner. Eyes deep sunken, red and lusterless. Then, according to Rajan Sankaran, he said that slightest criticism nicely explained that contradiction, reprimand, response to rudeness causes indignation. Expression, how it expressed in mental plane, mentally agitation, brain fag, does not like to do any mental and physical work, inability to concentrate, weakness of memory, and depression. And in the physical level, what happened? Insomnia, colicky pain in the abdomen, and that colicky pain in the abdomen as if the sub-cutting pain, as if cutting by a knife, that type of sensation. Chronic iritis, conjunctivitis, blepharitis, and prostatitis, styes, tonsillitis, cystic growth, ovarian cyst, and cystitis, and acne, and sometimes eruption on face, nodular eruptions. According to Rajan Sankaran, suppressed sexual desire because of fear of being hurt, embarrassment, expression is intense state of anxiety, neurotic anxiety, feeling that somebody is behind him. So he constantly looking back, and that leads to impotency, inability to sex, genital warts, ulcer on penis, and non-healing ulcer. And in case of female, pruritus vulvi, testicular atrophy, and cystitis. Then suppression according to hearing guiding symptoms, unmerited insult, disrespectful remark, which are not deserved by the recipient. And after a disappointment or a confrontation, and grief leads to becomes very sensitive to least impression, least what that seems wrong, hurts her very much. Later on, anger, trembling, headaches, especially a peculiar wood-like sensation, already have told you in the frontal and occipital regions. This sensation of wood is highly characteristic and it corresponds to the process of induration found on other levels as well. At mental level, they develop internal trembling, they develop chorea. According to hearing guiding symptoms, ailments from indignation and reserved displeasure. And if we consider all these symptoms, then we can cure the patient. Now, the sleepless result, as a result, sleepless, cardialgia, aching and intensive pain in stomach, at times aggravation after eating, especially bread, with frequent nausea and constipation and biliary colic. Anger suppressed, as a result, trembling of whole body, operation of chest, dyspnea, so that he feared he would suffocate. Pressure as of a heavy weight lying up on stomach, severe tension in epigastrium, nausea, and salty, bitter irritation. It's so severe that he wished death would relieve him, and sometimes paralysis on one side. Now I would like to express about our application of drug knowledge in the field of practice, that is called applied mathematics. In the case 3, previously I have described 1 or 2 cases. Now I am going to discuss about the case 3. Mr. XY, 48 years age, male, Hindu, MCom, teacher, and presently business doing, married. And then chief complaints, patient came with the complaint of pain in right knee joint since 2 years and bilateral ankle joint since 4 to 5 months. History of chief complaints, patient started expressing pain in right knee joint with swelling, lateral side since 2 years. It is gradual onset and gradual progression. Pain is more and long standing and better by extension of knee and wrist. This is also pain in left wrist joint. Since 4 to 5 months, patient has pain in bilateral ankle joint with swelling, which is aggravated by eating non-veg, sour food, drinking alcohol, and patient feels better by rest and massage. Patient is a known case of hypertension and hyperlipidemia since 2017, where he used to have vertigo. Patient was on Ayurvedic medication. Presently, he stopped medication due to side effects and values are under control now. Tested 6 months back, reports were normal. Now, the personal history, patient diet mixed, appetite good, thirst 2 to 3 liter, desired sour food, aversion milk products, disagree sour, bladder habits 4 to 5 times per day, bowels habit regular, and perspiration scanty, thermals chilly, dreams daily activities, addiction, occasional drinking alcohol. Local examination, musculoskeletal system inspection, right knee joint, swelling plus, but no redness, no deformity is found, deformity is there, palpation, tenderness, and warmth. Now, chronic totality. In mental general, there is a indignation, and in mental likes to be alone, brooding, and patient's honor wounded due to an incident. Physical general, desire for sour things, aversion to milk products, and characteristics particulars, right knee joint pain, aggravation sour things, and aggravation non-veg food, and heat cold relation, the chilly patient. Now go for repatriation. Then it is taken the totalate from the honor, effects of wounded, and anger, irritability, and indignation, food sour aggravation, and after repatriation, and considering the all other characteristic symptoms, Staphysagria given. Staphysagria 200, 2 drops in 100 ml distilled water, 20 drops dispensing alcohol, and advised to be taken daily once in the morning in empty stomach for 2 weeks. Then next follow-up, pain in bilateral ankle joint. Patient is 50% better. Pain in right knee joint. Had the scaly eruption on scalp, and that was itching of scalp, and generally good. And the whatever. Next, I'm audible. Hello, ma'am.
Yes, sir. Audible.
Okay. Then Staphysagria 0/1, 2 globules in 100 ml distilled water, 20 drops dispensing alcohol, to be taken once for medicine daily morning. Next follow-up, pain in bilateral ankle joint, aggravation and alternation alternately. So the relief is not permanently. Sometimes aggravation, sometimes gets relief. Pain in right knee joint now, ankle joint is like that, but knee joint, it will be more better than previous condition. Scaly eruption on the scalp also relieved. Itching of scalp 80% better. Sneezing, running nose, nose block, aggravation in dust exposure and getting wet. Gels are good. Next, Staphysagria 0/2 is given. 2 globules like this in 100 ml DW to be taken once full medicine daily morning. Next follow-up, the bilateral ankle joint is 80% better, but aggravation by initial motion and morning aggravation. Pain is there little bit in the morning. Swelling reappears after every 2 to 3 days. Feels difficult while walking. Amelioration by prolonged walking. Pain in right knee joint. Now it is better. Scaly eruption on scalp also relieved 80%. Itching of scalp almost relieved. And gels others are good. Next, Staphysagria 0/3 is followed, but we followed daily morning, and after that calcium fluoride 3x, 3 taps noon and night to be followed. Now regarding the investigation, on 15th October, uric acid was 7.7 milligram per dl. On 12th December, uric acid after treatment, uric acid coming 5.3 per dl. And on 9th January of 2023, uric acid 4.3. So this is the report. Actually, I have scanned the Xerox that is not perfectly visible. In the left side, 4.3 is a milligram per dl is seen, and in the right side, 7.7 milligram per dl. Next, here we see the patient's honor wounded and reputation is wounded, name, dignity, and respect. Staphys is a constitution which has lot of esteem, dignity, honor. They give lot of importance to what people think about them, what people to have good opinion about them. For them, respect, social position, self-esteem is very important. Naturally, such kind of constitution will have the following elements. Now, the case 4. That is the age 40 years male. The patient is in business, married, and the chief complaint is pain in the multiple joints since 8 months. History of present illness. Patient he was apparently healthy 8 to 9 months ago, but gradually pain is felt in the joints since 8 months. And then patient took painkiller. Pain first started in the bilateral ankle joint, followed by right knee, right wrist also. Later, there was a gradual swelling in the joints since last 4 to 5 months, which was first seen at the ankles, bilaterally followed by knee, wrist, right side. Stiffness present, lasting for more than 30 minutes pains once it started. Patient very difficult to walking and standing. And patient is finding difficulty to do any activity standing or walking. For a little distance, pain is better by taking rest, and generalized weakness is present. Appetite good, thirst 2 to 3 liters, desire sour, aversion milk, curd, ghee, disagree nothing specific, addiction nothing specific, sleep refresh, dreams of daily activities, addiction, cigarette smoking. Now physiological elimination, that is stool is regular, urine clear, perspiration normal, thermally chilly patient. Medically hypertension since 8 years and typhoid 16 years, age chikungunya 10 years age, family history father hypertension, mother hypertension, diabetes mellitus. Now the mental general, main thing we are weak memory, confusion in any work, lack of courage, cannot tolerate injustice, occasional anger, throws things away, and weeping. This is about the mental general. And systemic examination, inspection, swelling and redness in ankle, knee, wrist joints, palpation, warmth present at the affected joints, but no tenderness as such. Mild tenderness is there, but not so severe tenderness. Range of movements, ankle joints bilaterally, and pain during flexion and extension, knee joint bilaterally, pain during flexion and extension, and capitis present bilaterally. Wrist joint, no pain during movements. Investigation done, rheumatoid factor negative, ESR elevated, C-reactive protein elevated, X-ray of right and left knee, narrowing of joint space. Final diagnosis, polyarthritis. Now the totality of symptoms, weak memory, confusion in any work, lack of courage, patient is timid, occasional anger, throws things sometimes away towards his family members, cannot tolerate injustice, and sometimes weeping, but not expressing his problem to others, and desire sour food, aversion milk, patient chilly patient, mouth dry, swelling in joints are there. Now we will go for reparation. The anger, throwing things around when angered, mind injustice cannot support, mind memory, weakness of memory, mind timidity, mind weeping, and mouth is dryness, extremity swelling, joints, general food and drinks, aversion, and generally food and drinks, desire, general's heat, lack of vital heat, general's tobacco, desire for tobacco. Now first prescription is Staphysagria 0/1 to medicated globus in 60 ml distilled water. Then advice to be taken 1 spoonful medicine alternate morning for 21 days. Then on 26th September, pain is slightly relieved, pain aggravation on walking and aggravation on standing. Then go for Staphysagria 0/2, like that 1 spoonful medicine alternate morning for 21 days, 3 weeks. Next follow-up on 17th October, patient felt better by 20%. Swelling in the right wrist is reduced. Then again Staphysagria 0/3 given like this. Pain in next 14th November, pain in the joints reduced by 30%. Staphysagria 0/4 given. Next follow-up in 12th December, swelling in the wrist reduced completely, swelling in the left knee joint started to reduce, and no new complaints are there. So Staphysagria 0/5 given. Next follow-up 9th January 2025, pain at the wrist reduced to 60%. Patient is able to stand for a long time and also walk a little distance. Pain in joint reduced by 40%. Swelling in the left and right knee joint almost reduced to 60%. Swelling in ankle joint started to reduce. Now, then 6th February, then 6th March, then 8th April. And on 8th April follow-up, I am telling you, pain in the joints is reduced by 70%. Swelling in the left and right knee joints almost reduced. Swelling in ankle joint reduced in 90%. And no new complaints. Joints are good. Staphysagria 0/9 given and to be taken alternately morning. Now I am going for case 5. The patient is a male, 35 years, is a private teacher, and present complaint is headache, sleeplessness, heart stool, inwards vein in lower limbs since 8 months. Then details of present complaints. The patient came with complaints of headache in frontal area, temporal region, aggravation by exposure to cold and by mental exertion. He also complains of sleeplessness with heart stool and that are occasionally painful, associated with bleeding per rectum. Patient reports recurrent bilateral styes on upper eyelids, which are hard, nodular on palpation and painful. It is additionally he presents with visible veins over the right leg, suggestive of mild varicose vein, along with mild, not so severe blackish discoloration is there on the skin over both legs. Physiological generals is stool, hard stool, and painful with occasionally bleeding per rectum, sleep disturb, thermally chilly patient. Mental general patient is confused, easily gets offended by trivial matters, and patient does not know how to express. Actually, he is not telling, sometimes anger, but not so violently express his anger rather suppressed. Examination, inspection, there is styes on bilateral upper eyelid, totality of symptoms. What is the totality of symptoms? Easily gets offended by trivial matters, anger suppressed, headache of frontal and temporal region, aggravation by cold weather, sleeplessness, sleep disturb, heart stools, visible veins, black discoloration of the bilateral legs. Prescription. Staphysagria 200, 2 medicated globules poured into the 60 ml distilled water, 20 drops rectified spirit, and to be taken 1 teaspoonful medicine to be taken in empty stomach for 1 month. After 1 month, patient headache of frontal and temporal slightly better, that is there about 50%. Patient said heart stool not improved, stye still present, visible veins, gels, sleep is little bit improved, blackish discoloration same as it was. Staphysagria 1 ml, 1 dose given. Then asking to come after 1 month, on 15 July, he reported that his headache in the frontal and temporal region improved by about 90%. Constipation, heart stool improved, no bleeding per rectum, stye on bilateral upper eyelids completely resolved, visible veins in the right leg still present, but it is improved. But discoloration, the blackish discoloration is 40%, near about 40% reduced. Then I prescribed Saclac, and next follow-up, the patient didn't come. Case number 6, it is a very interesting that a schoolgirl, aged about 17 years, 12 standards she is studying, occupation student, unmarried, and the present complaints, the patient came to our clinics that headache, sleepiness, unable to perform daily activities, loss of appetite since yesterday night. Actually, yesterday night there is a there was an incident. Details of presenting complaints. The patient came with complaints of headache after coming from private tuition, not talking to parents, nor eating food since morning. And after details inquiry, she told few senior boys are following her while going to tuition, teasing her, offering love letters, and calling her. And that's why there is a very soft, girl is very soft, and she do not want to continue her further study. Then physical journal. What happened here? The appetite lost, reduced, thirst is 2 to 3 liter, desire and aversion, no specific desire, strong aversion to food after the incident, stool loose motion 4 to 5 times, and urine 5 times, no burning and difficulty, perspiration scanty, sleep disturbed since last night of the incident, restless and very disturbed, thermal state chilly patient, prefers warm, markedly reduced energy level. Menstrual history, at the age of 13, menarche, cycle regular, follow moderate, last 4 to 5 days, pain mild to moderate, cramps on first day, no associated menstrual complaints. The life phase investigation, that is family outlook, is a well-settled nuclear family. Parents are supportive and involved in academic performance, strong emotional bonding with the family. The girl having the bright and hardworking student she is a very hardworking student, studious, always among the top rankers in her class, well liked by teachers, but kept limited social interaction, sensitive to criticism, and easily affected by rude behavior, shy and quiet personality since childhood, and disciplined and respectful. No history of emotional trauma in early years. Preparing for a competitive exam, high pressure situation, she have a very tense about her examination, spending extra hours in coaching and self-study, emotionally reserved, relies on academic success for self-growth, worth recently attending private tuition outside school. So on observation that at our clinic, that avoid eye contact, appears emotionally numb and overwhelmed, sits quietly, speaks only when asked, mild tremor in hands noted, crying intermittently while narrating the incident, classes when emotional subjects are discussed. General examination, conscious, cooperative, appears emotionally bruised, not engaging in normal teenage behaviors, no phone, no music, no talking to friends, prefers isolation. Now, the repatriation, anger, irritability, ailments from after anger, vexation. Mortification, ailments after anger, and suppressed from sensitive, oversensitive, rudeness to, and aversion to mental work. So considering all these symptoms and considering the other characteristic symptoms available from the patient, the Staphysagria is prescription, 1 dose stat, and followed by rubra, and asks her to come after 7 days. But the patient came after 10 days, headache near about 50%, appetite improved, sleep still disturbed, sometimes talking to parents but thinking of incident, about the last incident, and in isolation when unable to concentrate his studies. Then given Staphysagria 1M 1 dose stat followed by rubram for 4 weeks. Then patient came that overall complaints 80% reduced. Rubram was given for 1 month. Follow-up after 1 month, almost no complaint. Rubram was given for 1 month. Next is case number 7. This is also a ragging incidents. The first year BHMS student, and it occurred is the 2010, 15 years back. It incident happened. First BHMS student, medical student, history of present illness. It is a case of headache repertorized and treated with Staphysagria 15 years back. A 90 years old male first year BHMS student was residing in a private hostel, faced an incident where some senior students came to the hostel and ragged the newcomers. During ragging, the patient was forced to perform abnormal activities, scolded by the seniors, and insulted with slang words. The patient felt deeply humiliated, dishonored, and insulted. He becomes speechless with trembling of limbs, withdrawn from his work, from his food, did not express his emotion even to others, even to his family members. On the same night, he refused to dinner, could not sleep all night, thinking continuously about the incident. From the next day, he did not attend classes and gradually became sick. After the incident, the patient reports a gradual development of headache on and off, which was progressive in nature. Heat correlation, he was a chilly patient. Now totality of the symptoms. Ailments from humiliation, ailments from insult, suppressed emotion, sensitive, patient is indifference, sadness, continuously thinking about the incident, loss of appetite, sleeplessness. Then repertorial totality, synthesis repertory, ailments from indignation, ailments from mortification, emotion suppressed, patient is indifference and preoccupied, sadness, sensitive, appetite diminished, and sleeplessness. After reperdition, ignitia, natamur, Staphysagria, lycopodium come, and considering the others characteristics, I have selected Staphysagria 201 dose followed by rubram for 1 week. Then second follow-up, headache reduced by 50%, appetite slightly improved, sleep slightly improved, still disturbed, but not fully, sleep is not sound, vitals normal, he has loose stool with cutting pain in the abdomen. Staphysagria 1M 1 dose given followed by rubram, morning, evening. And the third follow-up, it is after 15 days, asked to come report to the OPD. The patient came after 15 days, headache reduced completely, appetite good, sleep normal, vitals are normal, loose stool reduced completely, no new complaints. Now he is attending regular classes. This is about after a ragging incident. Now case number 8. The age is 18 years.
Sir.
Yes.
Sir, we have only 4 minutes. So I think we couldn't finish the 8th case.
Sir, ma'am, can you allow me only 2 minutes?
Yeah. We have 4 minutes. Okay.
Okay. So the
Yes.
the 10th class standard. Elevated creatine levels since 3 years of age. Patient, it is not I am showing. Next case, I am going for next interesting case.
Okay.
And now, as the case 9, I am due to time is less, that's why. Is a the case 9 is not coming.
Yeah, it's visible, but
Yes. History of present complaint. Patient was apparently well 3 months back. Suddenly, she developed the girl of the school student cough, which is continuously throughout the day. The cough is more while talking and cold exposure, along with pain in the right costal region during cough. This complaint remains same after the allopathic treatment. Appetite good, thirst is 3 to 4 liters. I am not telling about the vitals. The family history, parents are grandfather CA, bladder, maternal grandfather having the asthma. Now the menstrual history, that is nothing significant. Examination, everything is, all our vitals are okay. The main thing is life space of family outlook. Patient hails from a middle socioeconomic class family. Father is involved in business, mother is a homemaker. Siblings education levels, patient is 11th class, one in 10th class, one in 8th class. Early life, at the age 1, the patient went to live with her grandparents for 5 to 6 years and returned to live with parents after her younger sister turned 3 to 4 years old. Frequently visited grandparents as she disliked seeing her parents fight. Felt more comfort and happiness with grandparents. Does not share a good relationship with siblings. They tease her by saying, "You are a nanny daughters, not our own sister." She shows love and affection towards sibling, but they neglect to refuse it. School life, currently pursuing the 12th standard, good in studies, completes work on time, does not like to participate in school activities, and she has only a few friends. Instead, in school 3 months ago, scolded by physics teacher in front of the classmates, felt deeply hurt and called parents pick up her. At home while playing on mobile, her father suddenly snatched it and scolded her harshly. She cried and locked herself in her room. She refused to speak to anyone. Complaints started following this incident. So currently, he's just 11th class student. Now, the observation is normal, but in apparently others system is normal. Apparently nervous and anxious, bilateral eye blinking observed, and inspection there is no cardiovascular and respiratory system problem. Now the somatoform disorders F45 according to WHO, that you see that the ailments from indignation, anger, violent, quarrelsome attitude, food and drinks, chocolate desire, constant cough, talking, aggravation. And the medicine after repetition came Natamur, Bryonia, Naxmica, and Staphysagria. Now I'm showing you the patient's cough. Then I will give you, you see that how the cough is there. But you cannot do anything for the benefit of yourself. बहुत सारी किया, एक पैसा खर्चा किया, हम तो देखा नहीं, पूरा दिया कुछ नहीं. But you cannot do anything for the benefit of yourself. You mark the cough.
बहुत सारी किया, एक पैसा खर्चा किया, कुछ नहीं। हम तो देखा नहीं, बोला दिया, कुछ नहीं किया, सेंटिमेंटल बात किया, कुछ एक सब बताओ तो हम देखेंगे वो कुछ कब और साइको
So you see that the cough is, there is no expectoration, only cough during daytime, and during sleep no cough, only constant cough. There is no any respiratory problem on auscultation. There is no problem, and after investigation, there is all the reports are normal. So when after the reparation, Staphysagria come, then I have given Staphysagria 201 dose in sack-lack. Then follow up after few days, 7 days later, then patient 80% complaint reduced by previous medicine, cough with single paroxysm, aggravation by talking, aggravation by cold exposure, rubam is given. Then the third follow-up, the patient on 13th 2023 February, Staphysagria 1 dose with 1 dose is given, followed by sack-lack. So here you see that after the indignation, after the insult by the her siblings and scolded by the teacher, there is a cough started. Since that cough starts, and on examination there is nothing, but so this cough is starts due to gets insult, indignation. That's why Staphysagria was given, and patient after prescription of Staphysagria 1M is patient is feeling good and no cough is there. Thank you, ma'am.
Thank you so much, sir. Really listened wonderful cases of Staphysagria, and we got more knowledge about Staphysagria and even suppression. Thank you so much on behalf of IFPH. Now we are already 4 minutes late to start the next session.
Thank you, ma'am. Thank you, ma'am.
Thank you so much, and come again. Very interesting cases. So we can see more interesting cases from you. We are expecting that.
Yes,
now, I'm inviting Dr. Mariamma John. Thank you, sir. Bye-bye. Good night.
Bye. Bye.
Good night, all the participants of the English session. Now we are moving to Malayalam session. Dr. Mariamma John, you are welcome. Sorry for the delay.